Hi, I am Angela Hutcheson, that's me, and I appreciate the comment about my youth, whoever said that, thank you, because I have 3 little kids, and as you know, they age you quickly, and you start to see gray hairs, and you're like, oh no, how did that happen? But I've been here since 2007, and I feel like I cannot believe it's possible. I've been here almost 8 years, but it's been a wonderful, I love the upstate. Even though I don't sound very Yankee, I occasionally get the word y'all in my conversations, and I think that's fabulous. Now, most people think when they hear a dermatologist speak, we're going to tell you to stay in a box, but you know, sunlight can age your skin, but there are other ways of protecting yourself than living in a box. I do believe we live in a beautiful area of the world. It is wonderful. I love to be on the lake. I mean, wow, I haven't seen Jocassee yet, but I have seen Kiwi and Hartwell, and wow, and of course several others. So we're going to talk about how to protect yourself wisely, but I'm not a believer in just, you know, living in a cave or a box in this case. We're going to talk about skin lesions and cancers. We're going to talk about Mohs surgery, because believe it or not, I actually don't do much general dermatology. I do something called Mohs surgery. I'm a fellowship trained Mohs surgeon. And we're going to talk about skin cancer prevention and also how to age well, how to age your skin a little bit better. Let's go. There we go. Pop quiz. Who thought, you know, you never get out of school. Okay, if you can't see this, I'll try to read this as loud as I can. And we'll do true, false, and if you're not sure, you can just sort of mumble. But A, ultraviolet rays from the sun can penetrate through clouds. Awesome. Who said false? Did I hear any falses in there? I heard 1 or 2. The answer is true. They can. Some types of ultraviolet rays are safe for your skin. False. There are no ultraviolet rays that are safe for your skin, none of them. You can get sunburned on cloudy days. True. Has anybody gotten sunburned on a cloudy day? Yes, I have. You can get skin cancer on parts of your skin that are never exposed to the sun. It's true, yes. You guys don't need me, I'm leaving now. It's good, it's good. You don't need to use sunscreen if you have dark skin or already have a tan. False. False. Very good. Tanning beds are safer than the sun.
False.
Excellent. You guys have been reading. It's fabulous. Getting a base tan is a healthy way to protect skin from sun damage.
False.
Not so many, a little hesitancy there. It's very false. Sun exposure during childhood is related to skin cancer in adulthood.
True.
True. And it is smarter to tan indoors using a tanning bed where ultraviolet rays can be controlled.
False.
It is false, yes. Now, I've done this talk, I've actually given this quiz to a little bit younger of a crowd, and they got half of these wrong. So you guys are awesome. Really great. Yeah, it does. That's right. Intelligence increases with age. So congratulations, you guys. We're going to talk about skin cancer and pre-cancer now. So these are common pictures. I found one on byebyedoctor.com, which I just loved the name of that. I had never seen that website before. I just loved it. But these are pre-cancers. You see them very commonly all over the place. We've got a forehead of a nice gentleman over here, the backs of the hands, commonly sun-exposed areas. These lesions are precancerous lesions. They usually lead to squamous cells. They can lead to basal cells, and we're going to talk more about those in a second. They're very common. They're easy to treat if you catch them in this stage. We can usually freeze them off. We can use several creams that can treat them. If you've ever seen someone running around looking like a, do you need me to move? Okay. With a rash on their face from a cream, you do those sometimes. I feel kind of mean doing that to people, but I can give them nicer skin if I can get them through that. Because we're trying to prevent this, which is skin cancer. In the US, it's the most common form of cancer. If you take all different types of skin cancer and combine them, there are about 3.5 million cases that are found in about 2 million people every year. It's a lot of cancer. And every year there are more new cases of skin cancers than there are of the breast, prostate, lung, and colon if you put those all together. So there's a lot of skin cancer. 1 in 5 people will develop skin cancer in their lifetime. So take, you know, at every table, that looks like 2 at every single table are going to have skin cancer. So pick which 2 of you, I don't know, every table. We're going to talk today about only basal cell, squamous cell, and melanoma because they told me I only have 15 to 30 minutes to talk, and I can't talk that fast. But I usually include all of these, but there are a lot of different types of skin cancers of the skin. And so there's a long list here. There's even a couple rare ones that I don't usually talk about much. But some of you may have heard of these or may even have had some of these rare ones. But basal cell carcinoma is the most common type of skin cancer. 90% of these occur on the head and neck. We actually include in dermatology the backs of the hands as part of the head and neck. Don't ask me why, but it's included in there. There are some aggressive subtypes that are listed here called ulcerative, metatypical, morpheoform, infiltrative, recurrent. Does that mean they're more likely to get inside your body? No, it just means they're actually much harder to treat with kind of easy means like scraping them off or burning them off. We can't treat those easily. We have to really cut those off. There are some types of basal cells we can just treat very, very easily. A lot of them can be scraped and frozen or cut with a little easy excision, but these types cannot. These types that you see here are frequently found to extend beyond their clinical margins, especially when you find them on the head and neck. When they're not gotten off completely, they love to come back. They're sort of like the weeds that are in my garden right now. They just spring right up every rain, nothing I can do. They come back and they're often more aggressive as they recur. This is one of my very favorite pictures. The patient came in and said he gave us permission to use this, my partner's picture. So, well, my puppy scratched me a month ago, and this scratch on his nose stayed there a whole month, and he waited to come in and see us. It had been there way longer than a month, in case you're wondering. This is a long time. Another one, a pimple on his forehead that wouldn't go away. This is a basal cell carcinoma. This is a little bit more classic of a picture. If you were to go Google or look something up, you see this, what we call a rodent ulcer, where it's a little bit indented in the middle with a pearly border, call it a pearly papule with an indentation. Much more classic of a basal cell. Again, notice every single one you've seen so far is on the head. And I tend to pick on men in my lectures. I'm sorry, guys.
Good.
No, I'm sorry. I don't know why they're all guys. I don't know. Here's a recurrent basal cell. You'll notice it's not pearly. It's just a lump appearing in a scar. So this had been cut out. Here's the scar. It had been cut out before, and now you have this lump right here. So if I saw this, what I would do is just take a plug out of it and see what's going on. I would not presume this is more scar. I would take this out and see what's going on. It turned out to be a recurrent basal cell. Any questions about basal cell before we go on? I'm screaming as loud as I can, but I'll try. I'll get it as loud as I can.
I have a question.
Go ahead.
If you don't remove those,
Basal cells, if you don't take them off, continue to grow and are very, very, they like to kind of erode where they are. So are they like, they don't metastasize very often. They do occasionally, but about less than 2% of the time. But they can grow very aggressively where they are.
but they're not life-threatening like melanoma?
Not usually. There are cases in the literature of them killing people, especially right around the eyes. They will grow back and sometimes grow back into the brain. But if it's on your arm, it's not very likely to get inside your body and go to your lungs like melanoma or like a different carcinoma would. So it's not the same thing as a melanoma, and they don't turn into melanomas. I get that question a lot. One doesn't become another. But squamous cell carcinoma is the second most common skin cancer. It has some also very aggressive subtypes that are listed here. Any variant, however, in an immunocompromised patient, like someone who's had a lymphoma, or someone who's a transplant patient, or someone who's on prednisone for any reason, like my rheumatoid arthritis patients who are on a bunch of immunosuppressants, if you get a squamous cell, it's considered aggressive. Here's an example of a squamous cell we found in a very nice gentleman with a cold sore that didn't heal for 3 years. Despite taking a bunch of vitamins. And I love that he treated it with vitamins. I love that. But it shows that people do try to treat these things at home for sometimes long periods of time because they think that they can take care of them, which is reasonable. I try to treat my stuff too when I don't know what it is. But if something like this isn't going away and it's on your lip, you need to let your doctor know about it. The problem with this is when it is on the lip or on the temple or on the ear, they're much more likely to be aggressive. How am I doing? Am I talking louder? Okay. Here are two more classic examples, not quite as big, but they can look a little bit like basal cells with that kind of pearly-ish border, but they tend to be a little bit more eroded. And I'm sorry for the gross pictures. If you don't like them, you can just close your eyes. Now we're going to move away from skin cancer again and back into moles for a minute, things that can be not quite as cancerous, but a lot of people have moles. Most people have at least one mole on their body. Most of us get them at some time in childhood, and we keep them most of our lives without any problem. Every single one of my children, I have 2 boys and a girl, they all have one mole for some reason, all in the same place, and I don't know why that is. But they tend to be, they can be flat, they can be raised, they can mostly circular, they can be oval, they can have no color, and they like to grow hair, as you see here. Nobody likes that when their moles have hair. But what I want you to notice is just because it's not a circle doesn't mean it's not benign. What we look for in moles is symmetry, and you can tell that if you cut this mole this way, it's pretty symmetrical. And it's almost symmetrical if you cut it this way. It's just not symmetrical if you cut it on the tangent here. But most moles, we look for 1 to 2 planes of symmetry, and then we feel a little bit more confident, especially if there's a similar color throughout the whole mole. So moles do not have to have pigment, especially in lighter skinned people, but I like to see that it's all one color if it's got no color. I don't like it if it's got a little bit of brown or it's got a little blue over here. That would make me unhappy. I wouldn't like that mole, and it would have to come off, even though it's otherwise very benign looking. So these are all normal moles, or what we call nevi. Now we're going to look at some atypical moles. These are not melanomas. These are just what we call atypical or dysplastic moles. Some of you may have had some of these taken off. These are not symmetrical. These are all pigmented, but they don't have to be. But if you see here, you really can't, maybe there's one plane of symmetry right here, but you really can't find another one. This one's a little bit more atypical looking. I'm not sure you can find even one way to dissect it where you're going to be able to fold it on itself. And again here. These would probably all get biopsied maybe, or looked at very closely by the dermatologist. But none of these are melanoma. We call these atypical moles. Melanoma is a little bit further along that line. It's generally associated with UV exposure or ultraviolet ray exposure, especially with tanning bed exposure. It's very highly treatable. However, it's more likely than squamous cell or basal cell to be fatal if left untreated. This is very common, especially in darker skin populations, to leave their melanomas untreated, which is why we think it's more fatal in Hispanic and Black patients, because they tend to just leave them alone for longer. Not that their melanomas are more aggressive. Does that make sense? Here's an example, I know, I'm sorry, of a superficial spreading melanoma. You see how it's very asymmetrical. It's got no symmetry on it any way that you look at it. It's got these little pods sticking out. And you just would look at that and you'd know, I need to have someone take a look at this. Here's another example. And what I want you to notice is actually started to clear in the middle. And that's not always a bad sign, but that's often a bad sign that your body's trying to do something about this. Your immune system is trying to recognize this. So that kind of gets a doctor to pay attention to this. Here's an example of a nice lady on her cheek. She also had a little basal cell sitting right here. She's got a lot of sun damage. She also has another skin cancer sitting up here. So she's got a lot going on. But most significantly, she has this melanoma on her cheek. She has something called lentigo maligna, which is a superficial spreading melanoma that happens on very badly sun-damaged skin. It has a very special subtype. It's very hard to see under the microscope. I have a different talk I use this slide in that I'm not going to show you because you're eating, but where we actually excised this melanoma, and the actual margins to get this melanoma out were around here. It spreads out around here. So they spread a lot wider than what you can see with your naked eye. And that's what I want you to appreciate about that. Acromelanoma, which you can see, this is an African American patient here, a little bit more common in Hispanic, Asian, and African American patients, but it does happen in Caucasian patients too. So everyone needs to be checking their hands and their feet for these things. They can grow very aggressively, but you can see this, it's the exact same thing. We've got these little pods sticking out. It doesn't look normal. It doesn't look like a normal mole like we looked at before. And a lot of people have normal moles on their hands and their feet, and they worry about them, and they want them cut off, which we can do, but I don't worry about them till I see something that looks like this. There's something called nodular melanoma, which is the classic melanoma that you read about in the books, or would see if you kind of were looking this up back before the internet. This tends to be very aggressive because they grow very deep. They grow deeper than they grow wide. They tend to ulcerate, they tend to bleed. They're very ugly. We don't like these. Most people don't let these grow very large because they cause a lot of problems. It's usually the other types, the ones that spread like moss, that people leave a long time before they see a doctor about it. Now we're going to talk a little bit about Mohs, mostly because I was asked to, but also because I have a passion for it, because it's what I do. But it's because treatments for skin cancer have been appearing and improving rapidly recently. There are all sorts of different treatments for skin cancer, and each treatment depends on what's best for you and what your doctors are used to doing. So some patients have asked me, hey, I had a skin cancer 5 years ago and I wasn't offered Mohs. Well, believe it or not, even though it's been around since the 1930s, this very smart doctor developed this when he was a medical student. A lot of doctors didn't even know Mohs existed until the last 20 years. So it's really exploded in use. It's come to be embraced for a variety of skin cancers. It's mostly used for basal cell and squamous cell, but we can use it for just about any skin cancer. I use it mostly for basal cell, squamous cell, and thin melanomas. It's come to be accepted as the single most effective technique for removing basal cell and squamous cell. It spares healthy skin tissue, which is why we really like it. We don't have to take off large margins. We can take off just what we see with the cancer and a thin rim around it. It has the highest rate of removing skin cancer cells, and it has the lowest recurrence rates that are surgically found. It's lower than 2% of recurrence in most cases of skin cancer, which is better than just about any other way of treating most skin cancers. There are a few exceptions with the rarer skin cancers, but we're not really going to talk about those today. This is the difference between how a lot of excisions are done and Mohs. A lot of excisions, they kind of cut a piece of your tissue out, of your skin out, they send it to the lab, and they make what we call bread loaf slices, and they process those, and they look at representative pieces of these slices under a microscope. They might look at 3, 5, 10 slices. They end up looking at about between 1 to 3% of the margin, depending on what lab you go to. because of the margin that your doctor takes, and I do regular excisions too, it's statistically significant. But because of this margin that we take, it is considered statistically significant for them to call that 1 to 3% of margin that they look at clear. But with Mohs, we end up looking at 100% of the margin. So for example, if there was a little bit of cancer sitting right here, we would be able to see that, whereas if it was sitting right here, that pathologist would have missed it in a regular excision. This is an example of how we do it, how I were to do it in a day. So I would mark it here, take it off, and then it would end up in my lab. What are the indications for Mohs surgery? When other treatments have failed, for tumors at high risk of recurrence, or for those that have clinically indistinct margins, and when tissue sparing is important. Because Mohs surgery is time consuming and it is resource consuming, we can't use it kind of everywhere, and we don't use it for very small skin cancers that we think we can clear easily with other methods. Here's an example of someone that was done with Mohs surgery. This is him before we got started. Okay, anybody eating? Just disclaimer, there's about to be an open wound here. Forgive me for this. This is after. You don't have to look. This is how we closed him up. And this is him 2 months later. So not too bad, right? I love this gentleman because he's always smiling. It's my favorite thing about him. Nice guy. Another nice gentleman who had a basal cell that was hidden by his beard. He never saw this because he never shaved. Same thing, it was much, much larger than he would have predicted. Closed him up. Can't see it. Well, that's a good question. Well-placed sutures, done correctly, and he took care of it appropriately. We give instructions as to how to take care of your wound. So none of these people did scar treatments. So I don't tend to show those, but I do have slides showing that I do have a scar management talk I do. It's about scars, but it's for residents and those kinds of things. But this is a nice lady who came in. She was my most nervous patient ever, and I can understand it because it was on her nose. It was sitting right here. You couldn't see it. You could not see where it was. It was very hard to find. But this is how big it ended up being under the microscope. So under the microscope, you could see this basal cell. I could not see it with my naked eyes.
How do you know that she had it?
It was biopsied before. So I don't ever treat anything with Mohs that isn't biopsied by another physician or by myself beforehand. So we ended up closing her with what's called a bilobed flap, and she healed beautifully. So that's why we do Mohs. So Mohs is basically a skin sparing procedure where I take out just the margins that you see around the tumors, and then can try to take out as little normal tissue as possible to try to give people the best results possible. Because if I had to take out, imagine on that nose, if I had to take out a really large margin, how in the world would I have closed that? Well, I wouldn't have. I would have sent it to a plastic surgeon. But how would he have closed it? Well, it would have been much harder. But I'm just kidding. I don't like to torture my plastic surgeons like that. But it's very hard to close if you have to take out too much tissue. So you just take out what we have to take out, and we go from there. Let's talk for a minute about skin aging. There's two different types of aging that we talk about. We talk about extrinsic versus intrinsic aging. The vast majority of extrinsic aging, or externally caused aging, is photoaging, or UV caused aging. And you can see this. Has anyone seen this picture before? This picture was all over the news about 2 years ago. It's a truck driver who drove for, how long do truck drivers drive? 20, 30 years? So he's older. This half of his face, the right half of his face, has aged normally, how he should have aged. So if you could just cut it out, and The left side of his face has aged because he's been sitting with the left side of his face looking at the sun.
Right.
So look even at his eyelids, how much lower this eyelid droops. Everything is at least 20 years older on the left side of his face. His mouth droops, he's got more jowling, everything over here. And it's because of all what we call dermatoheliosis or sun damage. It's pretty extensive. So when people tell me, I don't believe that sun causes any damage to the skin, I pull out this picture and I say, yes it does. I have proof, visible proof that sun by itself, I mean he aged normally, I mean he aged also. So you do have normal aging. He's got all the normal signs of aging here, but in addition he has accelerated aging on this side because of the sun. Chronic and constant sun exposure.
Any way of reversing that?
I mean, if he could probably have some significant laser treatments and lifting and a bunch of chemical peels, and it would probably improve it, but not reverse it.
Yeah.
I'd have to, he's not my patient, so I'd have to feel his skin. He may not have enough skin texture left to do some things. So one of the common myths that we hear is that everyone gets their sun damage by the time they're 18. So my 40-year-old patient says to me, why should I bother putting on a sunscreen now? Well, the truth is, according to the Skin Cancer Foundation, we get about 23% of our accumulated sun exposure by the time we turn 18. We get about half of it by the time we turn 40. This is for an average person, not a tanning bed user, not a every week beach goer. Okay. We get about 75% by the time we turn 60, and by, after that, somewhere in there we reach our 100%. So based on us living 78 years, so most of us are living longer now, thank goodness. But so no, we don't get all of our sun exposure in our childhood, but we do get a good chunk of it. So those of us with kids and grandkids, we can help them get less sun exposure in childhood, and we can affect their sun damage as they get older. Studies show that a single blistering sunburn in childhood and adolescence doubles a person's risk for melanoma. One blistering sunburn in childhood. So if we can protect our kids and our grandkids in their childhood when they will let us slather them with sunscreen, we can actually significantly improve their health and their risk for melanoma. It takes 5 sunburns in adulthood to equal that. So it's pretty impressive what it does for childhood. And this talks about, the part that damages the skin is in here in this ultraviolet spectrum. It's because these wavelengths are shorter. These wavelengths, what we can see, only as blue really doesn't damage our skin. Red is actually up where the sun makes us feel good. It actually, infrared is what helps with SAD and actually helps with all those things. So you can actually get infrared and feel pretty good. And you can see that these things are actually very far away from the rays that are damaging your skin. So if one of those people that just needs sunlight to feel better, think about getting maybe an infrared light or something like that, or a light over there, or a full spectrum light, something that's going to get away from the UV rays. And this is why there is no ray that actually is good for the skin. Luckily for us, most of the rays are taken up by our atmosphere. A lot of them are taken up by the cloud layers, which is a problem in Australia because of the ozone layer, where they have a hole in the ozone layer. And UVC, as you see here, and one of the parts of UVB are taken up in the ozone layer. Well, if there's a problem with the ozone layer, some parts of UVC and UVB come straight down to the earth. That's a big problem. UVC is actually the most damaging UV to the skin. Lucky for us, we don't ever experience any of it unless you happen to work in a lab where they get some UVC. They use it to sterilize things. Sir. And I'm not an environmentalist. Did you hear everyone hear what he said about being in Australia? And so I am not an environmentalist. I do know we have to do something to keep the problems with the ozone layer from spreading around the world. It's a problem.
Yeah, are they holes in other places besides Australia?
I actually don't know. I think there are some there's some threatening to the ozone layer in other places. I don't know if there are actually problems like there are in Australia and other places.
Patagonia, we have it also.
In Patagonia?
Close to the Straits of Magellan,
So
where I come from, and it's very bad.
it's very bad.
Yeah.
Well, that's terrible. So got a good answer there. Thank you. And there are some, I mean, it's a big problem for other things, including it damages the coral reefs. It does some big problems, in addition to carbon dioxide and a few other things. But the ozone layer is very, very important. Now I want to read about Patagonia, but but it's very, very important, and this layer is very important to us. It blocks a lot. You can see how strong these rays are up here, how much less strong they are here. If anyone in the room was a pilot, you can see when you're up here in the stratosphere, these rays are significantly stronger than they are down here where we live. So they are getting much more damage. So I've tried to do some work with some of the airlines to improve their UV protection in the airplanes. Of course, that's a glass issue, and not really glass, but a 3M issue with protecting their planes that is far beyond anything. But when I was in fellowship, we talked a lot about that. How do we protect people in airplanes from that UV? It's a significant issue we need to think about. And now I'm done. Who's the fairest? Well, thanks to Magic Mirror Sunscreen, anyone can be. I have two very good friends I meet with for Bible study every Thursday morning, and every summer one of them shows up brown as that tropical tan baby that and my other friend always says to her, "You look fabulous." And my lesson from that is, if I can't teach my two best friends that pale is the new tan, I'm speaking to the wind. But hopefully, I've taught you guys that help us, help yourselves, and help your kids and your grandkids. That don't get blistering sunburns. Try not to get sunburned at all, and be wise about the sun, because it will help your skin as the days go on. Yes, ma'am.
What sunscreen number do you
Thank you for asking that. So I actually don't have a specific number that I recommend, because it depends very specifically on your type of skin. So in general, a 30 is probably good for almost any body, but there are people who are more sensitive to the sun. And you'll read, you read a lot that a 50 is not necessarily as good as 100, and 100 is not twice as strong as a 50. It actually is about how much UV it lets through, and it means that if you were exactly the same person, you could probably be out in the sun twice as long before you get burned if you're using 100 versus a 50. Because it's 50, you're able to be out in the sun 50 times longer than you could if you were naked, if your skin was naked. But there are lots of people for whom that's a little bit overkill, because you kind of think to yourself, if you have a 50 on, I don't need to reapply in 2 hours. Well, remember, all sunscreens degrade the second you put them on the skin. So you need to reapply every 2 hours. So probably for most people, a 30 is fine, unless you're at the beach or on the lake or golfing, where you're really out getting a lot of sun.